We discussed a few clinical scenarios that sort of showcase some of the clinical controversies surrounding novel dosing strategies for immune checkpoint inhibitors. So for instance, I asked the group how they would dose a patient with pembrolizumab if they weighed 60 kilograms. So the purpose of this question is really to kind of get people to think about what are the pros and cons of flat dosing in such a patient. So for those who may not know, prior to the change in licensing, a typical pembrolizumab dose was 2 milligram per kilogram, or in this patient's case, it would have been a dose of 120 milligrams. So the flat dosing that was approved was 200 milligrams. So is it really necessary in such a patient to give them this high of a dose? Why or why not? And then what about you had the same situation, but in an obese patient? So do you still want to give the flat dosing or maybe consider a milligram per kilogram dosing? So it's really interesting to hear what everyone was saying about what they would do in their practice. So another area in which we're lacking data is in discontinuation or intermittent dosing of immune checkpoint inhibitors. So there is some data to suggest that PD-1 and PD-L1 inhibitors, their clearance decreases over time. And then additionally, the exposure does not necessarily correlate with efficacy. So do we really need to keep giving patients such high doses as frequently as we do once they have a good response? Or can we sort of back off and even give patients like a treatment holiday? So can we give patients lower doses even and still see the same results? So this is an area that's really ripe for study and which I think could potentially save health systems and patients a lot of money.